Okay. Welcome, everybody. Thank you for coming this morning. And so we're going to enlighten you about a little bit about acupuncture. We're not going to go into all the physiology that is available, question and answer after. You can look all that up on your own. But we're going to really focus on the acupuncture as it pertains to the opioid crisis and how, as acupuncturists, we can help. And since there's only a couple of us here, very informal, if any of you have any questions, please ask. And so, brief introduction to acupuncture. Acupuncture is an ancient Chinese medicine that uses needles to stimulate various points on the body to treat a variety of health issues. Acupuncture is about 2,000–3,000 years old. It's been around a while. Acupuncture is very effective for physical pain, emotional pain, and addiction as it relates specifically to cravings, withdrawal, and detoxification. A little bit of the history with acupuncture for addiction has been fairly recent. Since 1970, and I think a lot of people aren't aware of this, they think it's a relatively new treatment for this, the Lincoln Detox Center in New York City has used acupuncture for detox for cocaine and heroin with quite good success. And there's already over 1,000 addiction centers today that use acupuncture. So to answer your question, sometimes there are specific addiction clinics already set up that bring acupuncturists in to contract at these centers, or pretty much all of us will do this type of treatment in private practice. And in 2011, the Bureau of Justice Association summarized, and it was a long paragraph, and you can look it up, but basically they have concluded acupuncture reduces cravings and symptoms, concluding less relapse. And that's pretty critical, that point. So acupuncture and physical pain. We all treat physical pain as acupuncturists. It does occur with addicts, and that is one reason addicts keep using to avoid more pain. It creates that vicious cycle. So the more physical pain they have, the more drugs they take. The more drugs they take, the more pain they have. So acupuncture addresses the pain and helps break the cycle. That's twofold. That's pretty important there. And it does that, and if you're interested in how this mechanism works, I can go into more detail, but acupuncture, scientifically, we now know it absolutely decreases muscle spasms, decreases inflammation, releases all the neurotransmitters in our body, blocks sensory nerve signals to the brain to tell you you're in pain, kind of like a TENS unit. And if anybody has any questions about how that works now or after, I'd be happy to tell you about that, because the physiology is pretty interesting on that. And then acupuncture and emotional and mental pain, which we know with addiction, this is very, very prominent. Depression, anxiety occur with addiction. Acupuncture can decrease these symptoms, and this is where the release of the neurotransmitters comes in. When you put a fine needle in the body, the brain is trying to figure out what we're doing, and whether the brain thinks, oh my gosh, life-threatening situation, I'm getting attacked by bees, is this like an antihistamine response? The brain knows something is happening. So immediately, it's going to start to release your body's endorphins. Endorphins are your body's own natural pain-killing system. With addicts, that goes down. And so the acupuncture increases endorphins, primarily dopamine, norepinephrine, enkephalins, and serotonin. And now they know a little bit of melatonin. So these are all the hormones that when a body is in homeostasis, regulates normally. With an addict, these are decreased or gone. So you can kind of see the cycle. So then they have to take more drugs. So the acupuncture helps release this in the body, and then the body takes over and keeps releasing it at a normal level. And then this other part is really, I think, pretty fascinating. A lot of research about acupuncture decreases the alert system of the brain, hippocampus, amygdala, and thalamus. We call it the HAT system. And that creates a calming effect. And there's been a lot of studies with this, with thermography, Doppler study. These three areas of the brain, they calm down, and it can be measured. And that's the part of the brain that puts the addict in panic, in anxiety. So if you can calm that system down, then it self-regulates. And it's a very effective system for the VA. The VA has been using this for pain control, but more importantly, PTSD. And the VA has utilized this for about 15, 20 years. I practiced in California, graduated 23 years ago, and even 23 years ago, this was a program in California. Now it's widespread. Idaho, we've been treating vets about the last 5 years, and very, very successful. Treats their pain, helps them with PTSD. Questions? Yeah.
I don't know if how related this is, but does it do anything for...
Yes, it can. It can. There are points on the body that are specifically for that. And kind of with acupuncture, the idea is if we keep doing the reduced blood pressure points, the body eventually gets the hint and takes over. So it self-regulates. It's not really a system, not meant to be a system, that you have to see us once a week, once a month, forever. If that's the case, sometimes with autoimmune, but with a lot of patients, once we get them regulated, the body, if we get to that healthy state, should be able to self-regulate. But we do treat patients for high blood pressure. But just, as a safety side note, if they have mild to moderate, then sometimes it's a standalone treatment. If it's moderate to severe and they're not on high blood pressure medication, then we are in contact with the physician. So again, it can be twofold. It doesn't always have to be one or the other. And yes, that comes with drug addiction also. And then acupuncture and cravings, because with opioid crisis, it's that craving. It's the addict that just wants and wants and wants and wants. And that's a critical point of this whole equation. Acupuncture can help with the cravings. Once again, that word dopamine. The release of the body's dopamine with acupuncture tricks the brain into thinking you are taking the drug. The more dopamine the body can have, it thinks, oh, I just took the drug without taking the drug. So we're kind of taking the place of that. So they get the high with the dopamine, not the drug. And then over time, the body will, again, start to make its own dopamine. And ideally, like I said, you want to treat a patient X number of times, and then hopefully they're on their way. But with something this critical, this might be a couple months, couple years, and it might also be in addition to other therapies. It can be a standalone treatment, can also be an adjunct therapy for other treatments, biofeedback, therapy, drug counseling.
You're not putting the needles into the brain, though, you're putting them into the skin, so how does the brain know to react?
You want that question?
Yeah, can I get that?
He wants that question.
Should I answer it?
No, you got to go to the mic.
Okay.
That's a great question.
Yeah, it is a good question. So, you're not putting the needles in the brain, but if you whack your hand on the table, you feel something, right? The only reason you feel something is because, first, nerve sends a signal up your peripheral nerves to your spinal cord to your brain, then back down spinal cord to the hand. And then you know something just happened there. So if you put a needle anywhere in the body, it is sending a signal to your nervous system directly to your brain in under seconds. So really fast that communication travels. So you can put a needle in your toe and it will affect your brain. Just like you can kick something, real hard and stub your toe, and your brain knows it really fast. But I think there's another aspect to how pain control works that I want to address a little bit, which is, and the stand makes me so nervous. It's like just the stand.
So efficient.
I know. So when you are in chronic pain, that's a dysfunctional state, which acupuncture is working on relieving in a number of ways, in addition to just the release of chemicals. So when you have you ever taken an opioid painkiller versus like a NSAID? Anyone ever noticed the difference? So you've taken ibuprofen though, Tylenol, something like that. So those are anti-inflammatory drugs that act on COX-1, COX-2 inhibitors to inhibit pain. Opioids like OxyContin, Percocet, actually might be wrong about Percocet, but strictly opioid drugs when they're not combined with an NSAID, they don't do anything about the inflammation in the body. So they just trick the brain into telling the brain there's no pain. Guess what? There is still pain. It's just numbing agent. So acute pain is a useful state. Like if you're running and you trip and break your ankle, pain there is very useful because it's telling you, stop stepping on that, your ankle's broken. And your central nervous system, though, your brain, it doesn't know what happened to your foot. Maybe your foot, it just knows something wrong happened. So maybe your foot got bit by a rattlesnake and you've got venom in your blood. Maybe you broke your ankle, maybe you stubbed your toe. It could be anything. But what the body does is it shuts off circulation to that area to protect the rest of your body. So, I just broke my ankle, say that. This blood circulation, all these circulation of chemicals to that area will shut off in that immediate time because it needs to make sure that if there's some toxicity, like snake venom, something like that, that it doesn't come up to the rest of my body. So acute pain we want, and we want that normal response. But people have pain for 20 years, back pain for 20 years, that's chronic pain. It's not a functional response. There may or may not be anything structurally wrong with the back there. But what the acupuncture does, what is happening though, because it's in chronic pain, there's limited circulation of blood to that tissue. And the only way an injury can heal is if new blood flow gets into the area, because we need nutrients from blood, oxygen from blood to go in there and heal the tissue, also to pull out metabolic waste, pull out broken blood cells and waste tissue that's in there. So that is disrupted in chronic pain. There's not normal circulation. You can put a heat gun on somebody who has chronic pain in the back, and you'll see that the back will show up blue or green. It's not getting warm blood to that area. So then come in acupuncture, right? Maybe we do needles in the hand. Maybe we do needles in the foot. It could be all kinds of places. The needle sensation, it stimulates something going on here. And acupuncture generally is not painful, but it is a stimulus to the body. So the brain says something's going on there, and it kicks off these enkephalins, these painkillers, endogenous painkillers that are in the brain. They go throughout the bloodstream, all over the body, and they soothe that pain response. Now that that pain response is gone, then normal blood circulation can go to the area of chronic pain and actually heal it, so actually allow the body to heal that process. And that is completely absent from how opioid drugs work, because opioid drugs, they do not do anything to solve the underlying problem of the pain, which is why people will be on them for years and years and years and years. And then, like Betsy said, they're also breaking down this normal function in the brain that's supposed to control painkillers, because it's an addictive type system. The brain says, yeah, I'll take more of those. You got as many painkillers as you can take, it feels good, I'll have more, but then we stop producing our own, and then we have no ability to regulate pain on our own. Yeah.
So when you talk about PTSD, where are you gonna put the needles? You gonna put it in my thumb or my finger or my ankle to help my mind? Or I don't understand how a needle somewhere in my body is going to help me with PTSD.
Right. So you can jump back in whenever you want to, Betsy, but I'll answer this.
Yeah, go ahead.
So bigger picture, I think, just step back, is acupuncture is the tool. within a greater medical system of Chinese medicine, or some people say East Asian medicine. I'm just going to refer to it as Chinese medicine since that's the main country of origin. Acupuncture means the insertion of an acupuncture needle. But why we do anything in acupuncture is all based on our training and understanding of Chinese medicine theory of how the body works, which is a completely unique and distinct medical system, completely different than the way Western medicine looks at the body. Some ways overlap, and some ways really don't overlap. So whatever the problem is, it might be hypertension, might be heart disease, might be PTSD, we're looking at someone from a different perspective. So we don't necessarily see they have this diagnosis, this code. We're looking at what's particularly going wrong with them. And then you'll choose points. Maybe you'll choose herbal medicines. Maybe you'll choose massage therapy, cupping. There's a lot of different techniques we use. Acupuncture is one of them. I'm gonna get to you in just a second. And so this greater picture is, do you think that your hand is not connected to your mind, right? Most of us think that these are different things. That putting a needle in the hand, how could that affect your mind? And that's based a little bit on the Western medicine model that cuts the body into different parts. Well, the body's not different parts. That's why it all moves together, right? You literally are connected from head to toe because otherwise these pieces would fall off. And the same thing with your mind. A needle in your body affects how your mind is working. So often, protocol we're going to be doing upstairs is a auricular acupuncture, needles in the ear. This is a protocol we use a lot for addiction. It's a protocol we use a lot for PTSD. And PTSD has all kinds of roots in pain itself, whether it's emotional pain or physical pain. And promoting that normal function of the body is really what we're doing. So PTSD is it's actually a disease state. It's something that's gone wrong. And anytime we're using Chinese medicine, we're just helping the body to correct the underlying process. So one person's PTSD is not the same as another's. And so we might use different points. But overall, we induce a parasympathetic state. So I think Stacy had a slide a couple slides back that was talking about basically down-regulating the sympathetic dominance. So in PTSD and trauma, we've been damaged in some way, and the body is on alert to protect ourselves all the time because something terrible happened. It could be all kinds of different things, but we're in this constant state of like something really terrible might happen again. And that's not a state to be in all the time. So we go between sympathetic and parasympathetic nervous system states. So sympathetic is like fight or flight. You're like ready to run, ready to fight. Parasympathetic is when you're able to let down your guard, relax, sleep, eat, digest. And so acupuncture very clearly can induce a parasympathetic state, allow you to relax. So it seems weird, right? How am I going to poke you with needles and you relax? But just go to any acupuncture clinic and you'll just see a whole bunch of people sleeping. Boise Acupuncture Co-op, you go in there and there's 10 people all just snoozing, happily relaxing. So it's very common. It doesn't seem, when you haven't experienced it, it seems really weird. How could getting poked with little tiny needles make me pass out and have a blissful little nap? But that's just what it does. What was your question?
Well, I didn't have a question. I think it's so balancing. I was just going to maybe simplify this theory a little bit. I think something that you all understand so well that maybe some other. Our whole entire system and body is made up of energy, minds, and meridians. Our nervous system and the energy that flows body. As you said, it goes like from our hand to our spine to our brain. So when we use acupuncture or acupressure, what we do is block them and then what we do. When we have PTSD, we are reliving something over and over and over, and our subconscious doesn't know the difference. What we experienced years and years ago. When it happens in our mind, it's as if it happened right now again. And that's what causes PTSD.
Yeah.
Experience these horrific events over and over and over in their subconscious, and it doesn't know that it's not happening right now. So acupuncture or acupressure will either block those energy channels to relieve that parasympathetic, or sometimes it will open those channels up to allow a better flow of energy. So you just picture in your body all of these super highways
Yeah, I think that you put that in a really good way, that we're trying to break that pattern of reliving the trauma. And especially if someone's acutely in that, it's like they're experiencing this problem again. So if we do acupuncture right then and get that to shift, get them to relax into a parasympathetic state, then they can relax. The only part I would moderate a little bit is that the idea of energy and meridians works for like 5% of the American public, and the other 95% basically don't believe in that. And on a correct sort of historical use and historical understanding angle, the idea of energy and meridians didn't come about until the 1890s via primarily mistranslation. And so those were never concepts during the 2,000-3,000 years of Chinese medicine development. Those words were never used to describe what we do. But you just got to think about, like, the bigger picture is we are full of nerves, full of blood vessels, full of fascia and electrical conductivity throughout our body. So you put a metal needle in there, it's going to impact all these things. And it might also be impacting some part of the body that we don't yet understand. So that might be, there's aspects to what people are talking about when they say meridians or energy. There might be aspects to that we don't yet understand how to quantify it. But other questions or other things you wanted to get to in the presentation?
So you're not gonna fix my broken wrist, you're gonna just trick my mind into thinking I don't have it.
No, that's what opioids do. That's what opioids are going to trick your mind into thinking you don't have a broken wrist. Your body is going to heal your wrist. That's literally the only thing that can heal your wrist. Your own, like anytime we get an injury, your bone is going to knit itself back together over time. No one can make it do anything else other than that. But what acupuncture is going to do is going to speed up the healing process by improving the blood circulation to that area and also relieve the pain while you're doing it. So that's one reason it's non-addictive, right? So opioid drugs, if you break your wrist and you're using opioid drugs, you can develop an addiction to that. They don't serve any purpose to decrease inflammation or speed up the healing time. None at all. Acupuncture is non-addictive. Acupuncture does speed up the healing time by improving blood circulation to that area, because that's the only way it can heal. New blood, new minerals, laying down new bone. And it also decreases inflammation in that process, which the drugs, NSAIDs can do, like ibuprofen and Tylenol, which Tylenol's kind of an NSAID, kind of not. Those can actually decrease inflammation, but OxyContin doesn't. That just tricks the brain signal into saying you're not in pain. And as soon as it wears off, your body says, oh yeah, I am though. I am really in pain. And often in more pain than you were before you started the drug, which is what leads to addiction. I don't know if anyone here has experienced that before. If you've taken opioid painkillers. I've had the ones in my life after surgery, and before I took them, I was much better off than the few hours after I had taken them, and then they wore off. So the pain increases afterwards for a lot of people, which is what leads you back to the drug immediately, and then back to the drug faster and faster. That's why we have addiction. It's not because people are like bad at controlling their lives or something. It's because it's driving an addictive process in the brain, which is changing the way the chemicals in their brain are working and making it more likely that they're going to need more and more of that drug and get addicted to it, which is why we have this huge problem, right?
So doctors prescribe pills, and I took half of one.
Right.
And I asked the pharmacist, I said, why are they dirty? And he said, well, that's what the doctor prescribed.
Yeah, I know exactly what you're talking about. Yeah, I had my tonsils out like 6 years ago or something, and they gave me 30. I think they might have actually given me 90 pills, and I took one of them and decided it was making my pain worse. But to overall your question, yes and no. So it's a increasingly epidemic problem, and doctors are trying to find solutions. That's why we're here, because acupuncture is a very effective solution, and we just need more people to know about it and get it integrated into our medical system, because there is no practical reason why acupuncturists are not in every pain ward in every hospital in the country. The only reason that it's not is people don't know about it. There's a lot of politics that involve internal bias and racial bias towards where this comes from, because acupuncture comes from Chinese medicine, right? So as Westerners and all of the ideas that many of Americans have about, that are holdover ideas from the Cold War, from communist China, all these things that they think medicine has nothing to do with politics at all. Medicine is medicine. A technique is a technique. And the only reason that it's not being widely used is really because people don't know about it or people haven't integrated it and believed in it. I believe it's Tennessee that recently is removing OxyContin and replacing it with acupuncture as the primary treatment for chronic pain. So things are shifting. That's Blue Cross Blue Shield in Tennessee. So things are shifting in state by state. And Idaho is not exactly like on the forefront of that, but we'd really like to grow this here and get it used, because medicine is supposed to be about using the right tool for the right job. So acupuncture and Chinese medicine, it's not the best tool for a lot of things, right? It's not emergency medicine. If you're having a heart attack, go to the ER. Don't go to an acupuncturist. If you broke your wrist, go to the ER and get it cast, and then go to the acupuncturist to help it heal faster. So it's all about using the right tool. This is a little bit random, but recently was learning about Bacteriophage Therapy. Has anybody heard of that? No, Mara has, because she was the one telling me about it. Bacteriophage therapy is bacteriophage is a basically natural. It's a cell that destroys bacteria, and it's very specific and much more effective than antibiotic treatment for bacteria. So we have this problem also with antibiotic-resistant bacteria. We just give a lot of antibiotics. The bacteria are smarter than them, and then we develop these super strains of bacteria. Bacteriophage therapy is a different method that's largely not used in this country, but it could be, and it's very effective. It does not breed antibiotic-resistant strains, so you can find out what somebody has with a life-threatening infection, find the bacteriophage that will kill that bacteria, inject it, infection's done. And the main reason that that's not widely used here is because it was first developed in Russia during the Cold War. So when American scientists said, hey, this is amazing treatment, we need to start using this, they were cast out of the medical community because people were saying, you're communist, that stuff's Russian, And it's not. Medicine is medicine. It doesn't matter where it comes from. We just need to use what works. And this is a tool that really works for pain. It really works for a lot of epidemics that we're facing today. And so it's all about just getting into the right hands of the right people. Mm-hmm. Yeah. And trying to change that. So trying to get doctors on board to prescribe acupuncture as a therapy for chronic pain. And I think everyone in this room has worked in detox centers before for drug addiction. And it's really effective to see. So different groups have found it and implemented it first. The Army and the VA have been one of the biggest groups to implement it, which is, you'd think they wouldn't be, right, if they're anti-communist and sort of anti-woo-woo stuff. And the reason is it's not woo-woo stuff. It's not communist stuff. It's just a medicine. It's just a tool. And groups that are very practical like that, so the military is highly practical, and VA is very practical, and they just want to use what works. And a lot of our other sort of healthcare systems are not exactly set up that way, that pragmaticism is the #1 goal, when maybe it should be. But that's really what we're here to kind of talk about, so yeah. I guess people over here can't hear us.
I think this one's on.
Sitting on. No, I mean people who are live streaming can't ask questions.
Correct.
So come down here.
They can ask questions.
Yeah.
Yes.
Did you have any more of the presentation you wanted to go through?
Oh, yeah, I'll come back up.
let me-
Yeah, but thanks for adding. And to kind of add to the bacterial aspect, acupuncture, there's a lot of research that it can increase T cells in the body also. So it has a big influence on the immune system also, which not just for opioid addiction addicts, but for the rest of us too. And the other thing I wanted to add, the Chicago court system, they have implemented acupuncture for drug offenders for probably 20 years now with great success. And if you're a first-time offender, one of the stipulations to graduate from the program is you have to have so many acupuncture treatments. And if you don't go to your acupuncturist, then you start over. And then second offender, same thing. You got to go to the acupuncturist. And they give these drug offenders many options to see an acupuncturist. If they don't comply, then they're back to square one. But the Chicago court systems have been doing that for a very long time with a pretty high success rate. So this has been going on for quite a long time. I just think the education is not out there. People are not aware, and it's not, we're not as proactive in Idaho as we could be. And then after the cravings, so you're off the drugs, trying to get off the opioids, then we have the withdrawal symptoms. And acupuncture can help coming from a lot of different angles, and this is really just some of the things. When somebody's in withdrawal, one of the side effects is the tremors, the shakes and the tremors. We have protocols that can certainly help with tremors quite effectively. Decreasing nausea and vomiting, very effective with acupuncture. In fact, Misty, the Tumor Institute here in Boise, they have a staff of acupuncturists. They treat a lot of the side effects of chemo and radiation. They're really targeting nausea and vomiting very, very effectively. In fact, that's pretty much the #1 go-to after chemo and radiation at Misty here. The other thing is decreasing anxiety. Obviously, addicts are going to be anxious, anxious for what they're going through. Acupuncture is very effective at anxiety. Again, to kind of recap, releasing all those neurotransmitters, kicking up the dopamine, the serotonin, the melatonin, the enkephalons, and really important to reset the alert system of the brain. One of the NADA protocols that we're going to demo in the rotunda is 5 needles in the ear. And part of the science behind that, a lot of those points are along what's called the auricular nerve. You trace that auricular nerve, goes to the part of the brain that decreases the alert system of the brain. So again, it tells the brain this is not an emergency and you're calm, kind of like meditation, or kind of like a lot of the pharmaceuticals that are out there that put you kind of in the zombie state. Yes, that's what it's doing also, but acupuncture is trying to do it naturally with no side effects. And there's a lot of information, a lot of scientific research to back that up. The other thing with withdrawal, decreases insomnia. A lot of addicts, they can't sleep. And then here we go with that vicious cycle. They can't sleep. Well, better take another drug to knock me out. So really effective with insomnia. And I had mentioned earlier, acupuncture can be a standalone treatment. If there's enough of us and we get into those clinics and we're there with the addict every step of the way. I mean, obviously that's the goal, but it can also be an adjunct therapy with methadone treatment. Some of the states are starting to do that also. Methadone is not ideal, but it's one thing that they offer the addicts. I don't know if you've ever seen somebody come off of methadone. It's not pretty. So sometimes it takes 24 hours, sometimes it takes several days, sometimes people are in there, lock themselves in their room for 2 weeks. That's where the acupuncture can come in again. And then the detox phase. Okay, so the addict, okay, we've got it to this point where we're off the drugs and we're doing good and they just did their withdrawal. Now their body is rebelling. It's going to go into shutdown because it has to detox. The liver's mad, the kidney's mad, viscerally it's mad. And so the detox process, this is also critical. This is, again, where the addicts are like, you know what, this isn't really worth it because I feel pretty crummy. So this is a really crucial point here where they need to get the help they need. And again, acupuncture, whether it's standalone, do they need biofeedback? Do they need to see their drug counselor daily? Do they need a mentor? They need a support group. This is a really vulnerable point for an addict, that detox, because it's not easy. So with the detox, like I said, they're not feeling very good. And they felt much better on the opioids. So we got to get them through this. So the acupuncture helps, decreases fatigue. It can give them back that normal energy they used to have. Increases appetite. That's critical because addicts typically don't eat. Decreases the sweating and the restlessness. A lot of times with detox, you got the night sweats, the day sweats, they're restless, they're agitated because the body is trying to get rid of those drugs that are still stored, fatty tissue, nervous system, liver, and the body, sweating's good. It's venting. We want the venting, but the body's got to go through that. So to decrease their suffering, the acupuncture can help the patient feel more comfortable. Improves the sleep. They got to have the sleep. If you're not sleeping, you're not going to get better. And then it kind of gets back to the same thing. We're still working on those cravings. Acupuncture, I can't stress enough. Yes, it does all these things, but it's very, very effective at breaking cycles. It breaks pain cycles. It breaks addictive cycles. That's critical because you got to break the cycle. We could treat and treat and treat and treat, and then, oh my gosh, this patient's doing great. Well, 6 months, then if that cycle's not broken and their brain doesn't tell them that, they're probably going to go right back. So that's pretty critical there. And then acupuncture, bridging the gap. And this is, we have kind of touched upon this earlier. Access to addiction treatment centers is a major hurdle. And we talked about that earlier this morning, that yes, we need more access. We need more education to the public and all of you in this room to, can we push for more centers that we're happy to go to and treat? I know we have addiction centers in Boise. They need to pull us in. A couple years ago when I moved here, I went to one of them and they kind of shook their head like, well, how can you help us? Why are you here? And I talked about all of this and like, well, no, that doesn't really fit in our model. But we're at a crisis now, so we do need to do something. So whether we're actually at a facility and all of us volunteer a couple hours a week, or they can all come to our private clinics. I treat half my practice as the VA. Out of half of those patients, say the 50% of my patients, at least a third of them are addicts. And we're making headway, and we are helping them. And it gives them hope. And yes?
Is that a 5-point auricular
Yes.
protocol that you would use then?
Yes, it depends. Yes, most of the time that's what we use, is the 5-point. It's fast, easy, convenient. That to me would be more of the model at an addiction center, where everybody can be in the same room, they're sitting, or in a recliner. I work at a comprehensive clinic. If somebody is hallucinating, actually psychotic, I'm going to do more points than that. I'm going to do the ear points, and I'm also going to do body points also.
So do you picture something where auricular points can get put in, folks go off to a 12-step meeting and then come back?
Yep, because we can put the needles in, and we can put ear seeds in or a little press tack. That's another system. So yes, the needles go in 20, 25 minutes, they leave. They can continue to press these points, which reinforce the treatment we just did. And you can leave those in a couple days, a week, to the next appointment. But yeah, to integrate it, then they go to their detox group, then they go to their counselor, and they might all have the ear seeds in. But this really helps. I mean, this is effective. I put those in for people that have fear of flying, and they push them on the plane. It's good for overeating, for sweet cravings. So yes, it's something they can take. It's not just, oh, while you're in the office.
I was hoping that we could use it. One is as a reason for someone coming in daily,
Yes.
so they can get their 12-step stuff in.
Yep.
As well too.
Yep.
And then also maybe your seeds, folks that are coming in and live in areas.
Correct.
Their own.
Exactly. Exactly. And it's not hard. You just need to figure out, once they know their points and a mirror, they can do it themselves. Absolutely. Yep. It is exciting. It is exciting. And again, when we talk about the gap between primary health care and us, it doesn't have to be one or the other. I used to work in an integrative hospital in San Diego, and I treated with orthopedic surgeons, chiropractors, massage therapists. We all work together. And not, for this particular crisis, but for pain management in general, if all our medicines did integrate and work together, the patient wins. The patient gets better faster, and they get a much better treatment overall. And sometimes, like Sean was saying, yeah, we have emergency medicine. Well, absolutely, you go to the hospital, you're not going to come to us. But then the follow-up could be with us. So it really is a team. It is a team. But acupuncture is a modality that we as acupuncturists know it absolutely works. It can be very, very helpful. It's just letting the public know and getting it out there. We're here for them. And we touched upon this. Sue already knows this, but types of treatments, a lot of them we do the 5-point protocol in the ear. The VA currently uses, this is kind of interesting, the VA adopted the 5-point ear protocol for PTSD probably 20 years ago, and they train the soldiers in the battlefield to do it on each other. So they're helping right there, not just for the PTSD, but also for pain. And they call that battlefield acupuncture. They're training a lot of the vets to do this. And like I mentioned earlier, body points can also be used. It really is kind of the situation. If you're just treating on the fly, if you're treating in a center, if you have a clinic, but you can just rely on the ear system. We're already at the end. Thank you for coming. Thanks for the questions. And we have a lot of studies. We have a lot of sources. You can contact our local chapter and get all the information you want on our website. And if we don't have it, we'll certainly provide it. But you can Google anything. You can Google anything that we talked about is all backed up. But our hope is that the word just gets out there. And maybe we can do this again in a couple months, and we can pull more people in. Oh yeah, we're licensed acupuncturists. If you're a licensed acupuncturist, you have L.AC after your name. We have minimum 2,600 hours of school. Most of us have 3,000. Post-grad, master's degree, 3.5 years of school. Very comprehensive. We have to take a national board and a state board. And we have to keep current with CEUs.
Important to point out that not everyone in this state doing acupuncture is an L.AC.
I see, right.
Correct.
And that's a whole other political issue, but L.A.Cs probably should be, you're first thinking of, be doing these treatments, but not necessarily exclusively, because also we need more people trained.
Right. In a situation like the battlefield, soldiers are teaching soldiers, which is fantastic, but they were taught by acupuncturists. So to teach that protocol, but that's 5 points. We do a lot more comprehensive. And Sean's talking about it's a little confusing for the general public. We have certified acupuncturists, it's a minimal, limited license. Only an MD or a chiropractor can have a limited license. Very limited training. Their point prescription may be 40 points. We know 500, 600, 700 points. They're doing more, hey, where it hurts, trigger point, very limited. Yes, does it have a place? Yes, but it's very, very limited. It's not comprehensive. And so it is a little confusing for the general public because certified acupuncturist training is maybe 3 months. Ours is 3 to 4 years, master's degree.
So are some,
Yes.
are there some boys see like MDs?
Yes, many. Oh, many, yes. Most of the, I've been practicing in Boise 15 years. Most of the pain management doctors will refer to us. Yeah, but I work with physical therapists. I have a good relationship with a lot of the pain management doctors, but a lot of people don't know, a lot of the pain management doctors do acupuncture. They would have, that's an example of a certified license. Dr. Monty Moore at St. Luke's, he does acupuncture on his patients. He's like, well, should we do an injection? Should we do ablation? Oh, let's do acupuncture. So there's quite a few in town that actually do acupuncture. Dr. Mallory downtown, he's does a lot of acupuncture, and he's one of the leading pain management doctors in Boise. But he does all the high-tech stuff also, radiofrequency ablation. But then he's like, well, you know what? I don't know if I want to go that route. I think acupuncture would be better for you. So I tag team with him all the time. So a lot of the doctors are absolutely on board. Yeah.
Because I know so little about it. I have a lot of friends who have had acupuncture and they speak highly of it.
Yep. Well, we'll be in the rotunda for a little while if you want a demo.
Thank you.
Okay, thank you. Yes, thank you. Thanks for coming.
Great day.
Where's the news? Where's the news team?
Yeah, okay. I guess we can do more promo next time.
Yeah, maybe we need to, well, you know what, have some, that was more people. I thought, so my husband today, he goes, my husband said, if you just have one, why stay here?
Yeah,
But
it's
no, I
weird.
think
The
it-
live stream's weird because you don't know how many people are watching.
Well, I don't know how much exposure we got.
Tuning in, yeah. No, they can't ask questions.
But those people ask questions that I've asked.
Health and welfare, health and welfare committee specifically try to talk to them when they
Stacy,
Yeah, all right.
to be like, come here.
Really, come
Oh,
here.
yeah.
Like, oh, did we tell you about this?
Right.
Yes.
Hi, you guys.
Hi.
This is Chief of Staff Mary Souza is a senator that. Yeah, so.
My name is Betsy DeGrandi.